I'll give you my last example. Just next time you go see your doctor and they do a blood test, or you're being told you have osteoporosis or osteopenia, you need to consider these. This is the way you're going to get better. But on the same side, I can say we have had many women patients in particular have got returned back to healthy, stable bone densities and reduced their risk of bone fractures or falls substantially. It's winning the simple. It doesn't take a drug. It doesn't take Prolia. I'll give you my last example. I had a woman recently who has been on Prolia twice. So normally you can do a 5-year term, and then you have to come off of it because it could be causing bone injury or weakening of the bone. And then you can go on it after a 2-year break. Then you can go on it for 5 years again. If you do that twice, you're done. And you can't repeat that because the risk is the bone becomes too weak and it can cause a spontaneous fracture. And so I asked this patient as she was finishing her second round, what are you going to do now? She goes, I don't know. Do I need to do something? And her bones were almost translucent. And I said, you definitely need to do something. But the literature says the likelihood of her fracturing a major bone in her body, like her femur, is very, very high. Within probably the next 2 years, she'll probably suffer a fracture.